To ice or not to ice? Don't delay tissue recovery. In this video, we're going to be going over the latest recommendations on icing, specifically using cryotherapy. What is the latest recommendations for athletes and runners, and how can we get the best rehab results? Now, if we haven't met yet, my name's Jellin, and I'm a physical therapist. I also started running Gait Analysis Clinic, and I'm a faculty member at University of the Pacific in UC San Francisco, where I teach future PTs. So talking about how we can improve runner and athlete outcomes is a dream for me, and I really enjoy it. Now, let's talk about what we'll learn in this video. Specifically, we'll talk about how to use ice, how to use cryotherapy. And newsflash, if you use it too much, you can potentially delay tissue recovery. However, there's some really good recommendations we can use, but we want to have evidence-based recs. We don't want to just use ice as much as we need to or whenever we feel like it. Specifically, there's some new models out there. What used to be rice is now turning into peace and love, and I'll explain exactly how we can approach rehabilitation, specifically using cryotherapy and using rehab techniques. So let's start with this. Now we know that ice temporarily improves pain levels. What it does is it decreases nerve conduction rates. It also is going to numb the area. All that can feel good for folks. However, excessive icing can suppress the inflammation and it can delay the tissue regeneration. So what does that mean? Effectively, what we're seeing is if you just ice too much, too frequently, too long, what that ends up doing is preventing our body from taking its natural process of recovery and regeneration. So I want to highlight this chart here for you, and I'll explain every single step of the way. So if we look at this, this is a large muscle injury. Now, the dotted line is going to be without ice. The solid line is going to be with ice. So we can see that initially, without ice, the damage, the muscular damage, the cellular damage goes up really high. That's our purple area there. Now, then what we also notice is that the inflammatory process goes up quite high as well without cryotherapy. But here's the most important part that I want you to look at. Now, that inflammation level goes up higher without cryotherapy. However, it actually comes down shorter without cryotherapy or icing as well. So we see that with excessive icing for a long period of time, it's going to draw out all of the inflammatory process, because effectively that icing is going to slow tissue recovery. It's going to make it so all the cells don't move as quick. We're not getting all that gunk, all the bad dead cells out of the muscle or soft tissue, and that's going to delay the regeneration process. And here's our most important part. Look at the green dotted line and green area. What we can see is that the regeneration process without cryotherapy or ice is going to occur higher. It's also going to occur faster, and it's going to then end slightly earlier. And then where research is really truly needed is continual research to confirm, do we see that functional recovery actually means better outcomes? We can see here without excessive cryotherapy that functional recovery starts earlier, and we can also see that it's got a higher peak. But does that truly mean better outcomes for patients? Is that an earlier rehabilitation outcome? That's really where the new research is needed. But what we do know is that excessive icing is going to delay the regeneration process. It's going to delay the recovery process. Now, I also want to talk about this with minor muscle injuries as well, because there's a little bit of a difference here. With major muscle injuries, the ice is going to help with pain relief. However, with those minor muscle injuries, we can see that there's still muscle death or necrosis. However, we can also see that that inflammation doesn't quite get to this high level, and we can actually see that with icing, so that's our dotted line there, with the icing, it's actually going to come down a little bit sooner. We can also see that the regeneration process comes up a little higher, a little sooner with that ice specifically early on in the process. So again, the same recommendations are going to be for minor and major muscle injuries. We want to ice more earlier on. However, we can see that the process has changed a little bit. And specifically what we can see with those minor muscle injuries is that the decrease amount of overall muscle death can actually help to get that regeneration process started. So that's why it's important to ice early on with minor muscle injuries. Now, that's why I'm going to say don't throw out your ice packs. A lot of us will do ice for patients all the time. A lot of patients will grab ice. A lot of athletes will grab ice all the time. Ice is still helpful immediately. And certainly post-surgically, it can be helpful. But we want to use it judiciously. So here's the clinical recommendations. Excessive cryotherapy or ice may delay tissue recovery and degeneration. That's what we just talked about. So we want to ice within the first 6 hours, and we don't want to use ice beyond really that 12-hour mark because we don't want to delay that regeneration process. And then really what we want to think about is the mobility, the exercises, maybe some soft tissue work, compression and heat. All those things are definitely going to help because we want to stop using RICE. RICE is going to be rest, ice, compression, elevation. We want to stop that model to manage acute injuries. A lot of this is coming from the British Journal of Sports Medicine. It's a great number of research articles that are out there. There's a lot of new information on this, which are guiding these recommendations. Hey, sorry to interrupt, but I want to tell you about something really cool. So, 2 ways you can improve runners' outcomes are going to be through the Running Clinical Specialist Certification, which is a step-by-step guide of not only how to do a running gait analysis, but how to work with runners and create a thriving running gait analysis clinic. And then also the Running Specialist Report. The Running Specialist Report takes the latest evidence in running research, similar to the cryotherapy and a lot of the topics we've talked about, and it's going to break them down into streamlined clinical pearls that you can use in your practice. It's a monthly report that you can get. It keeps you up to date on all the latest research and running rehab and improves your outcomes. It's definitely something really important for anyone working with runners. If you want to check out if you qualify for potentially getting a free trial of the Running Specialist Report, go ahead and check out the comments and the links and follow that, and it'll give you all the information. You can also download a sample copy of the Running Specialist Report. So back to our topic of conversation here, cryotherapy and ice. Now, the benefits of immediately icing after injury are proven. What we see is that it's going to have pain relief, especially for those major muscle injuries, but it's also going to control some of the swelling. It's going to control muscle spasms, and that we know, especially for some of those minor muscle injuries. And really more evidence is needed on some of the other things, but we do see that it potentially decreases a secondary injury. The thought process is that if you're icing excessively, it's just going to delay the inflammation from coming on. We can ice, but the inflammation still comes on because the muscle necrosis or the cellular death is still there. So what do we use as our model to address musculoskeletal injuries, especially those soft tissue ones? Well, this has been developed from what a lot of us have used RICE in the past. Rest, ice, compression, elevation. Now that developed into PRICE and that developed into POLICE, and I won't go through each of those acronyms, but basically we want to try peace and love because that's what the latest evidence is showing us is helpful. It's going to address an injury's acute and subacute phase of healing. It's also going to outline the patient education and address the psychosocial factors as well. Because the cornerstone of peace is going to immediately after the injury protect it. We don't necessarily want to give all this ice for an excessive period of time. We really want to protect it and then educate the patient on how they're going to get better. So we want to give peace and love a chance. Stop using RICE. It's going to delay the tissue regeneration and healing. Instead, peace, protection, elevation, avoid anti-inflammatories, compression, and elevation. Then we're going to follow that by love. Here's a great little infographic from the British Journal of Sports Medicine. So first we want to protect from the movements, the activities that are going to create more injury. We want to elevate it. That's going to help get some of that swelling out. We also want to avoid those anti-inflammatories. Now they're saying avoid ice here. And this came out before some of this latest research on using cryotherapy or ice for the first 6 hours, maybe up to 12 hours. So that's a little bit of an adjustment, but we certainly want to avoid things like anti-inflammatory medication and things like that. Then we want to compress it. It's going to reduce the swelling and educate that patient that the body knows best. We really don't want them to have all these passive treatments. We want to let nature play its role and let the body recover. Because now, after the patient goes through the peace phase, we want to give them love, which is going to shorten recovery time. It's going to promote active recovery with load optimization and really optimism, vascularization, and exercise. So here's our same infographic. We want to give some loading, and this is on the concept of progressive loading, progressive tendon loading exercises. We want to gently and gradually, incrementally get that patient back to normal activities. We want to let them decide, let their body decide when it's safe to increase the load. Also, it's proven optimism really helps recovery. People that are optimistic about their recovery are confident, they're positive, they get better outcomes. Also, vascularization is key. Vascularization is all that stuff that's going to help the body do its natural course of recovery. So if you can do pain-free cardiovascular exercises, that's going to help repair the tissues and get the patient back faster. And then lastly, the exercise portion is going to restore that mobility, that strength. It's going to improve their balance. We want to get them back to doing everything they were before, because that's the gradual return to activity instead of just having them actively ice it, rest it, and put themselves out of commission. We know that's going to prolong recovery times. Well, thank you for joining. In summary, give peace and love a chance. Use cryotherapy or ice for a shortened period of time, especially 6 to 12 hours early on, and that can really, really help your overall regeneration, your overall recovery, and what we're hoping is better outcomes for runners and patients.